Richard Rellis here with columnist Bob Robb, who has thoughts on Senator Kyrsten Sinema's prescription drug proposal, which I guess depending on which side of the aisle you're on, was seen as a way to help the government rein in prescription drugs, or Bob, the way you see it.
I do see it considerably differently. After the response of the private sector pharmaceutical industry and some particular firms to the COVID-19 pandemic we went through, producing in record fashion vaccines and treatment medicines and drugs, it would seem to me that politicians would want to be kind of cautious in giving the industry a giant shakeup. This bill, even though it purports to be modest, it says that it's only going to allow Medicare to negotiate the prices of a few drugs. That's just not the case. These won't be negotiations. These will be the government dictating what the price is. And it won't be just a few drugs because there's a mandatory rebate for any drug, the price increase of which exceeds inflation.
Was there a way to have a set of price controls that wouldn't have been as arduous, or is the best course of option to let the free market dictate the price?
One of the faults of not only this provision, but many provisions in the Build Back Better reconciliation bill is the failure to target. The cost of prescription drugs is a problem for some seniors. But the current system of competition through Part D, and Arizona has one of the more robust Part D Medicare prescription drug markets in the entire country in terms of the number of companies competing to provide that service to seniors. The system works fine for an awful lot of people. Now, there are programs that exist in Medicare to try to help low-income seniors for whom the cost of prescription drugs is a burden. It would be very easy to improve and augment those programs without shaking up the entire industry in a way that makes return on capital for investment in the production of new drugs far more of a risky and doubtful proposition. And the political problem is that the way that that will manifest itself is in fewer new drugs created. And you can't today say, okay, here's what we're foregoing by going this route rather than a targeted route, even though that will be the result. You are reducing the incentive to invest, significantly reducing the incentive to invest in new drugs.
And politically, because you mentioned Sinema getting criticism from even her own party within the state, was there a need for something to be done to go up against Big Pharma rather than just more aid to seniors?
Well, I don't know what the public opinion polls are telling the Democrats. I would hope that with the way the private industry responded in COVID, that their national reputation would be improved at least somewhat. But there was a way to help seniors for whom the cost of prescription drugs is a problem without changing the ability of the market to set prices. I mean, this bill creates ceilings on prices at very deep discounts to the market price, what the drug is being sold to other people for, of up to 60%. I mean, that's not, and you also have a provision that says that if you don't agree to whatever the government tells you the price is, the government's going to confiscate up to 95% of your sales of the drug in its entirety, including outside of Medicare. That's not a negotiation. That's the government setting the prices, and it will create a chill on investment capital for the industry.
Interesting insight as always, Bob. We should advise our readers, if hearing about and diving into this problem does give you a headache, please consult your physician.